to a very special episode of Capitol Hall. I'm your host, Christian Gardner, and with over a year into a coronavirus pandemic, Americans are starting to see the light at the end of the very long tunnel with vaccines. As of Thursday, the CDC has said about 112 million Americans have received the first dose of the vaccine, and just over 66 million have been fully vaccinated. Many states have taken this as the time to lighten restrictions, but have governments jumped the gun? Join me to discuss everything in the fight against COVID-19 are two of WSU's news assistants and, of course, producers here at Pirate Television, Veronica Gail, Rony Jerez. How are you doing, guys?
Doing good. Excited to be here. Excited to talk some news. Can't wait to see where the discussion goes.
I'm very excited. This is a very important conversation that we should be having. We can analyze whether the states are really prepared and if they're jumping the gun, but I'm really excited to be on my first Capitol Hall.
Now, let's start with the good news right here at home. New Jersey has seen 40% of the population receive their first dose and have been one of the better states in the rollout of the COVID-19 vaccine. So, guys, how well do you think New Jersey has done? And do you feel that Governor Murphy has taken a little bit too long to make everyone eligible? As of April 19th, he said that accordance with President Biden, that every adult will be eligible of April 19th. So, guys, has it taken too long for everyone to get the vaccine? How have you felt about this whole situation? Ronnie, we'll start with you.
Well, honestly, I do feel like the distribution process has been very timely, and I don't think that he's been rushing it, and I feel like that's something that you can't be rushed because rolling out a bunch of vaccines to millions and millions of Americans here in New Jersey is very densely populated, can cause a lot of logistical problems. So I do feel like Governor Murphy has been taking his time with it, really classifying it just for the most needed at first, and then seeing how the distribution process works, and seeing that now that that's worked, now this is the perfect time to have, he just recently announced, 16 and older being eligible for the vaccine, and I feel like now this is a great time for having everyone go out and get vaccinated. So his pace and timing has been pretty good so far, in my opinion.
I have to agree. I mean, the big date we were hearing was May 1st, May 1st, May 1st. April 19th is now our new date. So the fact that he sped it up however many weeks is pretty good. So definitely, I think they're doing a really good job rolling out these vaccines and getting them to the people.
Yeah, I have to agree. If you get to almost 50% of the population before we even get to these restrictions, and now everyone being eligible, that is huge. And one of the biggest things as well that we saw in the past few weeks is Rutgers saying that students, if they want to come back on campus, they have to be vaccinated. So what do you feel about this? Do you think other universities will follow suit? And more in particular, do you think Seton Hall should follow in Rutgers' lead? Veronica, we'll start with you.
I think they should personally. I mean, this is something I feel like I saw coming. We are already required to get certain vaccines before coming to universities and schools and things like that. So it's no shocker that this is something that we're going to have to do. So I think Seton Hall will most likely follow suit. We tend to follow what bigger schools like Rutgers do anyway. So I'm kind of expecting it. And do I think we should get it? Yeah, I think we should be keeping people safe. And if everyone is vaccinated, then maybe we could, start doing Capitol Halls without masks on and stuff like that. So it'd be really cool. I support it.
Honestly, I do feel like it makes things a lot easier to work with. When you know that everybody on campus is there in person, everyone is vaccinated, I feel like that kind of weeds out a lot of problems instead of having different rules for different people. At how it is right now, there's different set of restrictions for those that are not vaccinated, those that are, and there's no way of telling who is and who isn't. So making that everyone on campus is vaccinated, it makes things easier for the administration and everything. It lifts a lot of the mask mandates, depending on how the state handles it. But going to class in person and easing that worry a lot of people have. One thing though, I don't know if maybe fall is going to be the time for Seton Hall to maybe do it. They maybe will look at how Rutgers does it in the fall, maybe transition to the spring and make people have to do that like that. We'll see how that goes, and it's going to have to be in the near future, depending on how it is. But I do think that it makes logistics a lot easier.
Seton Hall wants to be a majority in person this coming fall, so maybe it is the right way to go. And like you said, Ron, it brings an extra reassurance if you're around people that are also vaccinated. I mean, this has been a tumultuous time with so much concerns. But let's shift to another side of New Jersey. I mean, they have done well with vaccinations, but along with that, Governor Murphy wants to lift a lot of restrictions, but we are also seeing a rise in cases around the state right now. So how do you feel with Governor Murphy saying that restaurants and gyms can be at 50% capacity now? Do you think that's the right situation or a good amount of precautions right here, right now? Ronnie, we'll start with you.
I do think that it's a good situation to have them open up a little more, especially now seeing that the vaccine is going to be available to most adults all over the state. So I feel like that kind of balance things out, and especially heading into warmer climate, it's been proven that the virus does not fare well in warmer temperatures. So being that now that the summer is right around the corner and businesses have been really hindered for such a long time, this is the perfect time with the summer coming, the vaccine being a lot more available to everyone, and with everything happening together, it's the perfect storm.
With this whole opening things and loosening restrictions, you want to go slow, you don't want to just rip the Band-Aid off. You want to take your time, do it slowly in stages. So I think Governor Phil Murphy doing this is a great thing, and as more people get vaccinated, this is slowly going to become, the rates will go down, and it'll end up working a little bit better. So I think he's doing the right here thing, going slow, slowly building up on what he's doing.
Veronica, I feel like you framed that perfectly because some other states have decided to go with a different mentality, like ripping the Band-Aid off. As we saw in Texas, huge headlines this past week as you looked at this Rangers game that had fans at complete capacity. They're supposed to be wearing masks, but a lot of them didn't follow that as the game continued to roll on. But Texas has decided to remove a mask mandate and come back to 100% capacity. Guys, what are some of your initial reactions to this whole situation and Governor Greg Abbott deciding to bring everything back right here, right now, here in April? Veronica, we'll start with you.
I think it's insane. I just think it's so crazy. I'm so used to wearing this mask. I believe you guys are too. This is like a part of my life. It's phone, keys, mask. That's what I need to bring with me out the door. The fact that now they're going to have people walking around without masks on, their vaccination rates, we're just not at that point yet, We need more people vaccinated. At the time Texas announced this, only 7% of their population was vaccinated. I don't think that's personally enough to tell people they can walk around without masks on. So I think it's the wrong move completely.
It's very jarring. It's very unexpected, and it's like a lot to take in. But like, who else but Texas? Because Texas is known to have these, different views on things and love to go big or go home. It's very hard to see, being that we're in such a densely populated state, and everything's been very kept under the rug, very secure and safety-wise. But in Texas, Globe Life Field, the inauguration of a brand new stadium for the Texas Rangers, it looked like footage from back before COVID, and it's very strange to see. And you can't control that many people in terms of mask mandates. I fully expected them to not be many masks worn with so many people around. So I feel like it's too soon. I feel like this could probably be something more normal coming next spring, definitely next spring, maybe heading into the fall. We'll see, who knows, hopefully. But I do feel like it's too soon to have this rip off the Band-Aid approach.
They always say everything's bigger in Texas, but they had this mask mandate removal back in March 10th, where cases were at 5,000 daily cases. But over this past month, they've seen things decline miraculously to 4,000 a day. Now, it's not the same, as you said throughout the show, Ronnie. New Jersey is a highly densely populated state. Is it fair to compare these two states, as Texas is huge, very broad, able to spread out, but New Jersey is also at 4,000 cases a day? So how do you feel that do they compare well? Is it fair to compare these two states, or is there something to learn from each other? Veronica, we'll start with you.
I think it's kind of hard to compare these states. New Jersey, I did look it up. New Jersey has 1,195 people per square mile, while Texas only has 96. So you look at that stat, you think, we are more densely populated, so it's easier to spread the virus. But I think, in a way, this could be a learning experience. We can see maybe Texas's way will work. Who knows? I don't really have faith in it. But it's hard to compare these states, but you can a little, but it's still kind of difficult.
Well, first and foremost, it's kind of a very hopeful sight to see that the cases are going down. Despite of whatever method they're using, cases going down is a great sign no matter what. So I'm very happy about that. Comparing New Jersey and Texas, I feel like it's apples oranges, especially that stat hit it right on the nail. There's so many different ways for people in New Jersey to contract and give off the virus so much easier because there's just so much more people in a smaller space. And then Texas, you can go miles and barely see, many houses. So I don't think it's very fair to compare both states, but either way, I feel like it's very, very, it's a hopeful sight to see cases go down no matter what.
Yeah, you love to see any cases go down in any situation, and luckily for Texas, we've seen that. But New Jersey, completely different situation. You guys have hit it. But now we're going to shift over to another state that's kind of the in-between of both of those states, California. It's one of the biggest states in the union and also has some of the most densely populated areas. And California, at a time, was the #1 place in all of the world with coronavirus cases. In the middle of January, they had 40,000 cases a day and have been able to get that down to 2,000 a day now. Miraculous and exactly what this country needs at this time. So guys, what have you seen from California, how they've been able to turn this thing around so quickly, and all love out there in California? Ronnie, we'll start with you.
I mean, California, what a way to really bounce back from 40 to 2,000, and that just goes with a lot. Governor Gavin Newsom, he's been very, very hard and strict about this, and to a lot of dislike of many California residents, they have been really not liking the way that Governor Newsom has really been restricting and really hindering a lot of businesses in terms of percentages of capacity. But this is exactly what we see, the results. We see it go from 40,000 at one point to 2. So credit to that administration, credit to Governor Newsom for his really tight stranglehold on this and being able to be proactive and try to diminish it as much as he could.
I completely agree. I mean, we saw all the restrictions he put in place. Outdoor dining was not allowed in California for a little bit. And it's warm there. People do dine outside, obviously. So just by having all those restrictions and being so tight, that's why they were able to get through this and really lower their numbers. So you see that strong force really does create results.
January to April has been huge, and now Governor Newsom has decided to lift some restrictions. Now restaurants open at 25%, barbershops and salons able to operate indoors now. Guys, do you feel that this is too soon, or is this time for them to reap their reward from doing what they needed to do? Veronica, we'll start with you.
I think it's time for them to reap their reward a little bit, Clearly, they're people who are getting COVID, it's going down. More vaccinations are going up. They can slowly start to open things now as, again, it's that layering effect, slowly bringing things in. So because they worked so hard in the beginning, yeah, I think they're doing the right thing, and they can start loosening some restrictions.
Honestly, I feel like because of the amount of work they've done so far, it's a lot easier to bounce back now in terms of coming back with the capacity restrictions and the masks. So now they're going to, 25% is going to be very similar to how New Jersey does it. And now that we're going to have 50% very soon. But I can compare that to California, New Jersey in terms of capacity. But they definitely have the opportunity to reap the rewards of their hard work.
Most definitely, and the biggest thing about that, California being the highest populated state in America, been able to vaccinate 36% of their population to get their first dose. That's been humongous for them. But we're going to shift things over to a national landscape. Now, 5 states, along with Texas, have removed their mask mandates, and several other states have lifted up to the local level. Now, guys, what do you make of this decision? I mean, it's been a full year of us wearing these masks, and I mean, nobody loves wearing a mask, but it's been keeping people safe. So, Veronica, what do you think about this?
Masks are the easiest thing, I think, throughout this pandemic we've had to do. Staying home, that's hard. Missing family events, not seeing family, not being able to do the things we usually do. That stuff's been really hard. Wearing masks, not seeing people's face, their smiles, it's annoying, but we can get through it. I just think there's so many better ways. If you want to loosen restrictions, I think that's it's the easiest thing to do. Why would you take that away? It doesn't really make sense to me. I feel like, again, they're just ripping off the Band-Aid and they're not doing that slow building, and it might hurt them in the end.
Yeah, it might bite the hand that feeds them, because masks have been proven to be the most effective way. If 2 people are wearing masks and being socially distant, then the possibility of really contracting the viruses goes down to such a low number. And that's been proven. And just by putting a piece of cloth on your face. And it's not like we wear these masks at all times. When we go home, we're able to take them off. That's only if we're in public spaces. But I feel like it's the easiest way, even if you're not vaccinated at all. It's the easiest way to try to prevent the virus. So I feel like masks are a key. Losing that mandate is very tough for those states. I don't really agree with it, but I feel like it's too soon for that.
I'm with you guys. Texas, Florida, Arkansas, Arizona, Wyoming are the 5 states that have decided to remove these mask mandates. And for me, I don't even know the next time I might go out the house without a mask, even when I'm fully vaccinated. But guys, I want to go to another state that you guys want to select that has either done well in the vaccine rollout in the fight against coronavirus, or another state that you feel, I'm not quite sure what you're doing at this point. Ronnie, we'll start with you.
I'm going to go right across the river. We're going to go with New York. I feel like I'm really liking the way New York and New Jersey really go hand in hand. And Governor Cuomo has been really strong in his stance against the coronavirus and rolling out vaccines and having vaccination sites. We saw MetLife, Citi Field, the home of the Mets, as a vaccination site, Yankee Stadium, vaccination site. And having these super centers really help get a lot of people going out, and they go to their favorite ballparks as well. So I feel like Governor Cuomo has done a great job with the vaccine so far.
I also love how Governor Cuomo is doing. I think he's doing great. The state I actually picked was New Hampshire, mainly because they have the highest percentage of receiving vaccines from the government and giving them out to their people. So they've wasted the least amount of vaccines out of every state, and I think that's fantastic. And they're starting to even slowly get their government out of giving out their vaccines and starting to rely on private healthcare facilities to just give out the vaccines. So it's great to see what they're doing over there. So they're definitely doing something right.
Now, to close out this show, I just want to talk with you guys. It's no secret. We've all said it so many times. It's been a struggle. It's been probably the longest few months that we've ever gone through. And we have to remember how beneficial we are to be in the nation that we live in, because there's a lot of countries, poorer countries, that haven't had the opportunity to get their vaccines yet. But for you guys, what has been the reason for optimism moving forward as we're nearly out of this tunnel? Veronica, we'll start with you.
Obviously, hopefully getting vaccinated. I'm supposed to get vaccinated next week. I'm very excited. But just trying to, now that we've been in it a year, I feel like I'm getting used to this more, and it's like my new normal. And it's kind of just looking forward to the little things. Looking forward to seeing my friends outside social distance. Looking forward to, I don't know, little FaceTimes with friends. So it's trying to just focus on the little things, taking it one day at a time has definitely helped me in my optimism. And
being that the weather is finally getting nicer around here, I feel like the optimism is through the roof. Last summer, the summer was non-existent. We were in the midst of the pandemic, but now this summer has potential to be a little bit better. And being that we can hopefully go outside a little more and enjoy the nice weather around here in New Jersey. So that optimism to me is really what I'm looking forward to. And being that vaccines are out, I feel like the ease of mind is at an all-time high right now. So I'm really glad to hopefully see a better future in the near future.
We're truly starting to actually see the light at the end of the tunnel. And I saw in New York Times a study that if vaccines continue at this rate, by July 22nd, 90% of the American population will be vaccinated. But that's going to wrap things up here on Capitol Hall. All the opinions shared by myself and my panelists are that themselves of their own. They do not reflect Seton Hall University, Pirate TV, or the Comm Arts Department. We'll see you next time. For Rony Jerez, Veronica Gail, thank you all for watching. We'll see you soon.